Hello, Dr. Tracy.
Hi.
Thanks for setting up this with me today. I'm pretty excited
for facilitating this.
We get to talk all things Pap Smears and HPV.
Yes.
I'm just trying to make sure we are live on our Facebook feed. So why don't we, while I'm confirming that, do you want to just chat about you and naturopathic medicine a little bit?
Sure. So, hi everybody. I'm Dr. Tracey. I practice at Collaborative Natural Health Partners, obviously. And as you know, if you've been treated by naturopathic medicine, you know that we work kind of like investigators, whatever health condition you might have. And so what we do is that we might use like some type of specialized testing. We might look at lab work a little bit closely to make sure that you're getting whatever care you need and we get to the root cause of whatever issue you're experiencing. But I like to work with women's health, and so that's what I like to look at women from this angle of like a whole body approach. So that's a little bit about naturopathic medicine and like how we approach it.
Awesome. Perfect. Yeah, and so, I mean, we've been practicing together for a little over a year, and we got to import you from a school in Florida. And you also have your background in traditional Chinese medicine and acupuncture, which is awesome. So it's really great to have been working with you. It's really fun. And I think we decided to pick a topic based off of a couple of things. One of the things I think with this medicine is there's a lot of things in conventional medicine where it's a wait and watch, or people don't feel very empowered with things that they can be doing to be proactive. And I think this is particularly when it comes to a Pap smear, which is something every woman should be really having.
Yeah.
I think that this is such a great time to like have people feel empowered because of that, you know? So I guess, we made a cute little outline for us to do talking points, and I should have really printed it out, but we can certainly touch on like, when we're talking about HPV and Pap smears and women's health, I guess we could start by just talking about like, what is a Pap smear, right?
Sure. So you might be wondering what your doctor is doing down there every time that you go to get your Pap smear done. But essentially, we're like visualizing the cervix. You might have seen that tool that looks like a duckbill, basically. The cervix lives at the end of the vaginal canal, and we take a tissue sample from the cervix. And basically what we're looking for is if any of those cells that we then have taken from your cervix are abnormal anyway.
And I guess, when we're talking about abnormal cells, we can dive into what that means in a second. Yeah, so essentially they're taking a sample of that tissue, right? And it's a service that's covered by insurance. So insurance companies have to cover a well woman visit every year. And even though you may not be indicated to get a Pap smear every year, you should always go in and get that appointment and get everything looked at and checked to make sure you're in a good spot. Yeah. When we're talking about a Pap smear, there's several things we get for information from that, right? And the of it is abnormal cells, which can be a sign of changes in the tissue that could lead to cancer.
Yeah.
So when you get results of a Pap smear, when they look at this stuff, they're looking at really several different things. The report will actually say, did you get a sample? Did we get a look at all the cells on that tissue of the cervix? And that will give us information of like, okay, we got a good sample. And we'll say, of the sample of cells we got, are there changes to the cells? And we're going to talk about that more in a minute. And additionally, they'll sometimes, and often it's more common now, they'll screen for a virus known as HPV, right? That we're looking for to make sure that they are seeing if there's any risk of anything irritating the cervix, like a virus that would make the cells make mistakes, make changes. So how often should people be getting a Pap smear? Well, not people, women.
Yeah. So women
Then you get these.
sure. So there's different age ranges and like different requirements, and there's so many, so it can get confused. There's like different like agencies that make these rules, but typically, women start getting Pap smears at age 21, and age 21 to 29, they should get Pap smears about every 3 years. With respect to HPV, only if there's some abnormality seen on the Pap smear. And then the next category of women is age 30 to 65, and those women should have a Pap test in HPV at least every 5 years, but we like to do it on women every 3 years with the Pap smear only. And then women age 65 plus, so that's like more of a case-by-case basis, but that's when women should stop dreading going to the doctor to get their Pap smear done, because the risk at that age is lower.
Awesome. Yeah, so I think that's a thing to be people are mindful of, is that like there's those great women exams are covered by insurance, but also that, you know, it's something we want to do on a fairly regular basis.
Yeah.
So yeah, I realized you jumped into some stuff I already answered as we look at our notes here. So when we talk about like we get the results back from a Pap smear, when you do your due diligence, and you can certainly go to many primary care do this. A lot of OBGYNs obviously are doing Pap smears for most women, and then actually naturopathic physicians are trained in it. You know, you and I both went to the same school where I thought we had a wonderful training in it. I had to do all my first Pap smears when I was in med school on Yale midwives who were like, oh, don't touch that. Yes, do this. You know, so we had wonderful training in it. So naturopathic physicians can do this, and I think it's a great skill set that we have. And so I think that's another thing that people don't always understand. Yeah. So when we get the results back, let's talk about what those results look like and what it means.
Yeah. Sure. So like when we get results back, we always want to make sure that the doctor got whatever sample that they should, so that the test could be adequately interpreted. And so it might say like negative for, if it's normal, it will say negative for interepithelial lesion, meaning that there's no abnormal cells present. And that's where we get into like the different grades of the interepithelial lesion, which just is a fancy word for the cells are abnormal. And then we could get into that a little bit. So many women, they're told that they have atypical cells of undetermined significance. So it's like, what? I have atypical cells? What does that even mean? But like, so it could be that, you know, HPV might have been present and caused some changes to the cells. But sometimes things like even having like a yeast infection could actually cause like just minor mild cellular changes that tend to resolve over time. And then we get into like the more serious grades, like many times if for example a woman is found to have like a low grade squamous interepithelial lesion of the cervix, then she'll be sent for colposcopy, which is basically like binoculars on your cervix to see what kind of changes there are, and biopsy is taken at that point. And so then from there, there's a system called CIN, which stands for cervical intraepithelial neoplasia. So it's from like grade 1 to 3. 1 is like mild cellular changes, 2 is like moderate cellular changes, and 3 is like severe dysplasia. And then from there, it could be like precancer or carcinoma in situ. So those are more, like the higher the grade, the more closer it is to the possibility of it being cancerous, essentially.
You know, I often liken it to, you know, if you have a stack of paper, like, so basically the more stressors on that cervix, the more sloppy mistakes they're going to make. And then those mistakes become more at risk for making a mistake that could look like cancer. So I always liken it as a pile of work you have on your desk. Like if you have a huge pile of work, you're really stressed, you're more likely to make mistakes, versus if you have just a little bit of paperwork, not a lot of stressors on your body, then that's going to translate into the cells making mistakes, and then those mistakes are less likely to turn into cancer. So yeah, it's really about looking at like how, when we see the changes in the cells, it's basically how stressed out are those cells, how many mistakes are they making. And so, yeah, so a lot of women are told like they have these levels of changes in the tissue. And, you know, there's different treatment options, and in some cases there's a wait and watch depending on what's happening with them, right?
And so, yeah, there's one of the most common is like the loop. It's like a electrosurgical procedure where they're basically taking out the portion of your cervix that has the abnormal cells. But yeah, we're saying a lot of times before it even reaches to that level, women are, told to like wait and see either 6 months or a year out. Come back next year and come back for another Pap smear, and we'll see like where you're at. But that's, I guess, where naturopathic medicine could come in. That's kind of could work with the body in different ways so you just don't have to, could be more proactive.
Yeah, and I think the wait and watch is definitely a nerve-wracking thing to say, like, what, my cells are making changes that are not good, and then like I'm supposed to just wait and see what happens. And I know there are, so they've shown in studies that, like, up to 50% of women who have an abnormal PAP, it, due to HPV, may resolve it on its own.
Yeah.
So that's why it's the wait and watch. But I think that a great way to look at this is that it's a symptom of some underlying stuff, and that's kind of what we're talking about today. Is that, like, an abnormal Pap smear is a sign that there's something else going on if your body's having a hard time with a virus or there's other imbalances in the body. So that's definitely where you want to kind of look at it. Talking all things Pap smear, one of the questions is what's the age for a woman to have a first initial Pap smear? I typically send people to consider well woman exams, certainly if they have any symptoms sooner, but when they become sexually active is definitely a time to be starting this because of the prevalence of HPV, and we'll get into that in a little bit. So as soon as they're sexually active, they should be looking at getting Pap smears. And if they're not sexually active, I think the guideline is still 21, correct?
Yeah, 21, yeah.
Yeah. But certainly sooner if they're sexually active sooner. So we'll jump back into, so you get told, one of the things you could get told is, like, some level of treatment may be needed, or more frequently, even often, they'll be told wait and watch. The other thing you could be told when you get a Pap smear is that you may have a virus, correct?
So HPV stands for human papillomavirus. And it's actually like about 90% of cervical dysplasias are actually caused by HPV. So this virus, like, we've been dealing with viruses all year, so we're really familiar with dealing with them. But it's very common. I think about 1 in 2 Americans are exposed to it at some point in their adult lives. So it's super common, and it's one of the viruses that doesn't have any. It potentially does not have any symptoms, but HPV could actually cause things like genital warts, throat and oral cancers, anal cancers. So there's other things that it could go on and express as.
Yeah, the interesting thing is that the only way we really test for this virus is through a Pap smear. It's not like it's a regularly screened thing for males in general, and it's not really screened oral at all either. So this is the one time we really come in contact, like, we look at this virus when it comes to medicine, because of the impact on the cervix, although it can also present as genital warts, right? Mm-hmm. Specifically to certain strains.
Yeah, exactly.
One of the things that I think, there's a lot, we got lots to talk about when it comes to HPV. We kind of touched on, like, that, it's very common to come in contact with it. Has a stigma to it because of the fact that it's sexually transmitted. But it's one of those things that I think it's important. One thing I've seen is that, a woman's had the same partner for 25 years and then they suddenly get an abnormal PAP. I think a really important thing is to know that there could be a latent infection, and that it doesn't mean that there's any promiscuity. And if it's a monogamous relationship, it certainly could be that, they're compromised stress-wise, they're going through menopause, they have a stressor in their life, they, other things going on that could be causing the infection to come out now. So it's not necessarily, while it is sexually transmitted, it's not necessarily like immediate, right? Where you have,
Yeah, so definitely could be dormant in the body, just like a lot of the viruses we love. They could be
Yeah.
dormant in the body, just like HSV1 or 2, and they pop up, like, especially like you were saying, in moments of life where there's more physical, mental, or emotional stressors. So yeah, that's definitely a big part.
Yeah. So I think it's all the more reason for self-care and making sure. And that's why it's important to like screen for it, because we don't want to, like, especially when you are stressed and it's self-care goes the wayside. I mean, part of your self-care should be making sure you're doing these screenings,
Exactly.
stuff checked, you know?
Mm-hmm. Mm-hmm.
As we're talking about, regular screenings is a way to prevent HPV from getting out of hand. Any other prevention you want to share about?
Oh, sure. Um, the use of condoms has also been shown to prevent HPV, about 70%. But the fact that HPV could also live on the skin outside of just, the genitals, like the thighs and other skin areas, that's where, it's not 100% effective, but it can be very effective to help prevent HPV.
Mm-hmm. Yeah. And so there's prevention of HPV, then there's making sure our immune systems are in a good spot so that it doesn't get left unchecked, so that it can't turn into a dysplasia and then a cancer, basically, is our goals with it, right? And so yeah, condoms do help, but it's not 100%. So it's definitely something to be mindful of,
Mm-hmm. The other thing we have to talk about is the vaccine, right?
Yes. Yeah. Well, vaccines.
That will fall under prevention, right? But
Yeah.
what I will say about the vaccine is it's actually called like the Gardasil 9, so it prevents against like 9 strains of HPV, but there's actually over 100, like 30 of which affect the genital area. So there is a possibility that you could be still infected with HPV despite getting the vaccine, and still have to be proactive of doing all the self-care things when it comes to like guarding your health, because you're still susceptible. That's what I'll say about the vaccine when it comes to that.
Yes, and I mean, I've certainly seen Pap Smears, regardless of HPV. So I think that another myth around the Gardasil is that, like, well, I don't want my child to get, my daughter later in life to have an abnormal Pap, and like that's not entirely what this vaccine does. It just prevents against a few strains of HPV.
Mm-hmm.
Once you're vaccinated for that, if you choose to do that vaccine, then it's not like you don't have to get Pap smears. So I think there's that misinformation out there. We want to make sure people understand that, like any virus, we want to make sure we're healthy so that it's not a problem to deal with the virus. And that's a key piece of things. The vaccine does have some limitations with age as well, correct?
Say that again. I'm sorry.
The vaccine has some limitations with age as well, correct?
Oh, yes. So generally, children, males and females, as young as 9 could start getting the vaccine. It is recommended for females at 11 and males for age 11 to 12. Now, you can, if you've missed that window, you can, get like catch-up vaccines is what they call it, for age 13 to 26. And if you're above the age of 26, it's one of those things where they're like a case-by-case basis. They'll give you the vaccine.
Okay.
But that's the general recommendations when it comes to the Gardasil.
Okay. Let's play a game of myth and fact when it comes to HPV. So is it true or false that HPV types 6 and 11 are responsible for cancer?
No, that kind causes the warts.
Okay.
So the warts associated with HPV are caused by the strain 6 and 11, not typically associated with cancer. Yeah.
Okay. And are there strains of HPV that are more commonly known to cause cancer?
Yes. Like 16 and 18, which is like the ones people are probably the most familiar with, if they've heard those numbers. Those are the ones that could progress to cancer, and it's part of what the Gardasil is made to prevent. And then there's also several other strains like 31 and 45 that could also be cause cancer.
And can cervical dysplasia turn into cancer very quickly, or does it take a long time?
It can. There's always one of those things where there's always exceptions to the rule.
Yes.
Typically, it takes about like 10 years to develop. It's very slow growing, so it can take 10 years to develop into cervical cancer.
Okay. Okay. But so at least getting a Pap smear, like they recommend every few years, is definitely key. Yeah. And we know some risk factors cause issues with abnormal Pap smears. Is definitely one of them. What are some other risk factors for an abnormal Pap smear?
So smoking, like poor nutrition, the things that we talk about, stress. It could even be for some people stress impacting digestion, then impacting how you absorb certain nutrients, and then impacting how your body heals over time. And so, I mean, that's the way we think about it. But generally speaking, the things that they say put you at more risk is smoking, obesity, poor nutrition, unprotected, and even stress. They name as one of the risk factors.
Definitely. I mean, and all those things, like I was doing my analogy of like, the more paperwork your cells have to do, the more chances they make mistakes. So the more stress on your body's immune system, the lack of nutrients is certainly very stressful for your body. And, you know, all those things will make your cells have a harder time and making mistakes for sure. So when we hear something like you have an abnormal PAP, and you go see a naturopath, what kind of stuff are they going to talk about and think about as far as like, how can we be proactive around that?
Sure. So that's where I think it comes back down to like treating the individual, because you know, we're known for running all the blood work, but it's basically to find out like, do you have any kind of nutritional deficiencies, whether it's B12 or folate, vitamin D? Is your thyroid not in the best shape possible? It could help again your body to heal, support the cells. Is your blood sugar off in any ways? Do you have higher inflammation levels in your body? So case by case basis, we kind of look at the patient and see where we could kind of fine tune their treatment plan to help support them in the best way. Awesome.
Awesome. Yeah, I certainly see hormone imbalance being a piece, as well as nutrients on a lot of them. And a lot of the, you know, you can certainly Google and see treatment protocols for HPV. Oh my gosh.
Oh no. Lauren? Well, Lauren is gone, but there's definitely different things that we do in the naturopathic world, whether it's like botanicals. There's certain botanicals that we might give in order to help your body fight off the certain viruses. These can include things like, one of my favorites is like the berberine herbs, like golden seal or licorice. Nutrients, some of the nutrients that we mainly give is like B vitamins. We like to look at whether people have trouble absorbing B12 or folate, which a large portion of the population does, because that has been shown to increase your risk for cellular changes on the cervix. There's also other things like curcumin. Earlier, I was talking about the different inflammatory markers that we might find on blood work. Curcumin is one of my favorite things to lower inflammation in the body. So there's a lot of things that you could definitely speak with your naturopathic practitioner or other person who knows how to deal with supplements or herbs to help put your body in the best place to fight off the virus. Lauren's battery died and she'll be right back with us. I'm not sure if anyone has any questions. I'm not sure if I could check here.
Woo! I'm so sorry.
It's okay.
I feel like that's a metaphor for my day.
It's okay. I just went through like a whole battery of stuff people could use.
Amazing. That's great. I love it. That's perfect. Yeah. I feel like it wouldn't be a Facebook Live if I didn't lose my battery at one point. So for everyone who's watched more than one of these, sorry guys. So yeah, so back to Pap smears and abnormal Paps and healthy cervixes. So yeah, there's a lot of stuff, there's a lot of things microbial, like you talked about, there's a lot of things we can do to address hormone imbalance. There's making sure your nutrients are there. There's fighting off a virus. I'm sure there's all the great nutrients that we know work really well for viruses. a lot of things in our tool belt, and I guess one of the questions I get asked is why don't they hear this from their OBGYN? And the truth is that there's only so much you can know in medicine, and like one of the things we know well is this prevention piece of things and helping the body help itself. And I think it's just a matter of like, you know, they know that a majority of a big chunk of women will get better without having like doing anything. But I think for us, you know, when that cervix isn't happy and there's this virus that's kicked up and no longer dormant, we want to address it, right?
Yeah, right. And I think it all goes back to like also like we talked a little bit earlier about stress and like the mental emotional aspect of it, like making sure your body's in a good way, in a good place, because typically when women have a complaint of like HPV or cervical changes, there's other things going on too, right? So whether like I talked about earlier, whether it's like gut issues with their gut, issues with their hormones, so yeah.
For women or men who if you haven't seen a cervix before, right? It kind of looks like a little baby donut, like a little like circle, and it's like the softest, smoothest skin. It's very sensitive, and that's like it's such a barometer for a woman's health, like that tissue, you know. And so I think it's really important that we you know, listen to it, make sure it's healthy, and also like make sure like pay attention when we're seeing an abnormal Pap smear. I think there's a lot of shame around it for some women because of the stigma with HPV, which is crazy. Most people have been exposed to HPV. Not crazy. It's unfortunate. It's unfortunate that we put a stigma on it. And so then it's like, I'm just going to wait 6 months and see what happens. And it's this is a time for women to empower themselves and go like, no, I need to make myself a priority.
Exactly. Pay attention to yourself, right?
Yep. So, anything else you have around thoughts or things around HPV? We covered a ton today.
I think we covered a lot.
We did. Even with our technical difficulties.
Yeah.
Well, and certainly, you know, like we'll be doing, I think there's going to be an ECHN is going to do a lecture and a PowerPoint with HPV and natural things. So we'll kind of deeper into some of the supplements and things and what we think about with them, and certainly recap some of this again. So if people have questions, awesome. If not, go get your Pap Smears and feel empowered by them.
Yes.
Awesome.
Some practitioners let you look at your cervix if you're into that.
That sounds pretty empowering. Well, thank you so much for spending your Wednesday evening with me talking about all of this. And I will see you bright and early tomorrow.
Yes, I'll see you tomorrow.
All right. Thanks, everyone, for sitting in. Take care.